on obstetrics and gynecology. This is another very important fibroid what I'm discussing. So in the previous lecture we have discussed about the leiomyoma. In this video we'll be discussing about the malignant form of it, that is leiomyosarcoma. So students and viewers, do remember that when looking at, actually this is there are two terms. Firstly, we need to understand that what do you mean by leiomyoma, and what is the difference between leiomyosarcoma. So students and viewers, do remember that it is in leiomyoma, so wherever the suffix oma has been added, so that is referring to certain kind of a benign condition. So if the condition is benign, the suffix oma has been added to it. And whenever in pathology, or in certain some places, whenever in general pathology you find that the suffix sarcoma has been added, so that refers to the malignant form of it. So viewers, do remember, when we look at the suffix, just remember that when we take into consideration that what is a condition which is having a suffix oma, so that is referring to the condition of which is called as a benign condition when it is looking at the oma. And just a suffix oma wherever it has been added, it is referring to a benign condition. But when we understand that what is the difference, when we look at wherever the suffix sarcoma has been added, so viewers, do remember, so that it is referring to a malignant neoplasm. So it is a malignant neoplasm with smooth muscle differentiation. So already, so this, wherever the sarcoma suffix has been added, it refers to a malignant neoplasm with smooth muscle differentiation. Now we look at the gross features. So understanding the gross features, it is a solitary, large, poorly circumscribed, soft tumor, and the cut section does not usually show characteristic whorled pattern. So in the previous leiomyoma, which is the benign form of it, so we have already seen that they show the cut section of the leiomyoma, it shows a whorled pattern. But in case of leiomyosarcoma, what do we find is that since it is a it is a malignant neoplasm, so in the gross feature of it, what do we find is it is poorly circumscribed soft tumor, and the cut section, it does not show the characteristic whorled pattern. So the characteristic whorled pattern is not visible in case of the leiomyosarcoma. So they may contain certain hemorrhagic or necrotic areas. So viewers, do remember this leiomyoma, when it comes to the gross features, the gross anatomy, it is a solitary, large, poorly circumscribed soft tumor, and the cut section is not showing any whorled pattern. Apart from this, they may contain hemorrhagic or necrotic areas as well. So when we look at the microscopic examination, so the tumor is hypercellular, it is pleomorphic, and it shows excess mitotic activity since it is a malignant neoplasm with atypical mitosis is seen, as well as necrosis is seen. Now, when we look at the secondary changes in cases of leiomyosarcoma, there is hyaline degeneration and cystic degeneration. So do remember, firstly, there occurs in the soft smooth muscles, that is, there is going to occur the hyaline degeneration, and later on the cystic degeneration. The hyaline degeneration is going to end the result of it will end resulting into this cystic degeneration, and later on the tissues may also show calcification, that is, the calcium salt deposits are found in the tumors. Later on, the fatty degeneration is seen, particularly in the subserous leiomyomas, and deposition of fat globules in muscles. So if the lesions are if the myomas this leiomyosarcoma, if it is having a pedunculated form, so this torsion of the pedunculated lesion can be seen. And secondary changes, what do we find is that there can be hemorrhage because of the rupture of the veins of the leiomyomas can result, and they can result in a hemoperitoneum. So actually, when the blood vessels what are surrounding this leiomyosarcoma, so when they rupture, it is going to cause hemoperitoneum, and there can be infection at the lower pole. So this is in this video I have discussed about the difference between that leiomyoma and leiomyosarcoma, students, and what how do we differentiate between the terms. So wherever the suffix myoma has been added, it refers to a benign condition, and once the suffix sarcoma has been added, it refers to a malignant condition. So both the gross anatomy and the microscopic examination of both that is leiomyoma and leiomyosarcoma I have already discussed. So students, this was a very short discussion about the gross anatomy and microscopic examination of leiomyoma and leiomyosarcoma. Students, this if you still have any queries or comments, you are most welcome to comment me in the comment section. And students and viewers who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. If you like this video, give this video a thumbs up. Thank you for watching.